my words of advice to other men regarding erectile dysfunction is to come to grips with it right at the start, and in fact plan how you would handle it if you had the scenario of not getting erectile function after the operation. And in doing that, maybe then part of the options, or a number of the options, is that in fact you get engaged with some type of sexual health therapist that in fact taps into both the physical and the psychic to get you back to a level whereby, again, things being relative at 70 years of age, and if you're then still happy to be performing at that level as a 70-year-old. For the men who don't achieve full erectile function again, you need to come to a reconciliation to the fact that bearing in mind your age level, and bearing in mind and being realistic of where you were in that particular function at the time when you had the operation. And just remember, one of the main things that run through my mind at the time is that your wife is just as much suffers from that particular situation as you do, and you're not the only one. And in fact, you need to then, as I said earlier, think about a main game bigger than the main game, and have diversionary functions and activities that in fact go away from that particular situation of having erectile function, and just be satisfied with the fact that you are at your stage in your life, and you're well in yourself other than that particular factor, which in the overall scheme of things is fairly minute. Prem first said to me, where do you rate this, when he's talking about sexual function at one of the first interviews. I said, I think I would probably rate it 4 or 5. It's not my dominant function. He said, oh, what were they? And I nominated a number of other things in my life that I thought came before, like my family and my relationship with my wife and my relationship with my friends, are all far exceed my personal necessity for being totally potent.